Hello, my name is Ardavia Amos, and I will be presenting a Level 2 case series over patellar tendon graft versus hamstring tendon graft, the functional outcomes for ACL reconstruction. ACL tears are one of the most common injuries for female athletes. That is due to their wider Q angle of the pelvic. Most injuries do result in surgery, and ACL reconstruction surgery is recommended if the athlete does want to stay in their desired sport. ACLRs can be performed with quadriceps tendons, patellar tendons, or a hamstring tendon, and that's just what this image here shows. And so patellar tendon graft and then the hamstring tendon grafts are the two most common that are used. In this case series, there were two Division I female soccer players that tore their ACLs through non-contact 2 days apart from each other. Their surgeries were on the same day. Patient A received the patellar tendon graft on her right knee, and patient B received the hamstring tendon graft on her left knee. Both patients were assessed bi-weekly after surgery. With the intervention, I was able to collect 13 weeks of data, which is about 5 months short of a normal rehab, a minimum for a normal rehab protocol for ACLR surgeries. In the first 6 weeks, both patients worked on initiating quadriceps activation as well as reducing that swelling in their knee. And then for the next 7 weeks, or phase 2 of the program, they worked on more muscular endurance, strength, and power. So after completing phase 1, patient A had a slight decrease in girth while patient B had a more significant decrease. So that swelling and that joint effusion was a lot smaller in that patient B rather than patient A. And then for the range of motion part of it, patient A had an increase of 143 degrees of flexion and 0 degrees of extension, while patient B had 148 degrees of flexion and 3 degrees of extension. And after completing phase 2, patient B was showing more significant signs of progress in muscle control, endurance, and strength when compared to patient A. And also compared to the literature, patient A, who received that patellar tendon graft, was showing more, should have shown better results than patient B, but that was not the case. So the findings from this study was that the hamstring graft was progressing more and faster through the rehab phases. Both patients are still currently undergoing rehab, but I can conclude from my research that the patient B may possibly return to participation before patient A. Clinical bottom line, it is vital to start post-rehabilitation immediately after ACL reconstruction to increase functional outcomes. I would say that rehab should be tailored more specific to the individual rather than a recommended criteria.